There is no compromise when it comes to the corruption. You have to fight it. If you will accept it, it means you are also the part of that corruption. So, signs and symptoms of Amebiasis: 90% cases are asymptomatic infections with no symptom. Amoeba lives by eating and digesting the bacteria and the food particle in the gut and does not invade the gut wall. It not invade intestinal cells due to the protective layer of the mucus. 10% of the cases are symptomatic as the disease occurs when the amoeba attack cells lining the intestine. Symptoms manifest 2 to 4 weeks. Onset time is highly variable. Symptoms are acute or chronic. Disease intensity vary with the strains of the amoeba, immune response of the host towards the amoeba, and associated bacteria and the viruses which are living there. Infections can last for a year if there is no treatment offered. So the continuing signs and symptoms: mild diarrhea, frequent stool per day seen to the dysentery. The severe form with the blood is seen sometimes. The blood comes from the bleeding lesion as the amoeba invade the lining of the colon. The hot stools contain motile form and the trophozoites. Cold stool contain the cysts mostly. There is colic or severe pain or tenesmus in acute cases. Constitutional symptoms like fever, loss of appetite, weight loss, and malaise are also noticed. Extraintestinal complications due to the invasive infection entering the bloodstream, that is different from the localized intestinal involvement. Steroid therapy provoked the severe amoebic colitis with the high mortality, so one should avoid the steroid in this. Now, coming to the diagnosis, there are 8 parameters for the diagnosis. Number 1 is history. Number 2, stool examination. Number 3, blood examination. Number 4, serological test. Number 5, radiological test. Number 6, aspiration. Number 7, biopsy. And number 8, the other test besides all these 7 tests. So the first, the history of the patient. There is mild diarrhea to dysentery with the blood which the patient gives history. There is colic or severe pain, tenesmus, and the constitutional symptoms like fever, loss of appetite, weight loss, and malaise is noticed. Number 2 in the diagnosis is stool examination. Blood and mucus is positive in acute cases and negative in the chronic cases. The pH of the stool is always acidic. Microscopy of the stool examination that tells the trophozoite with ingested RBCs and the cyst which is always quadrinucleate form, and that is different from the other amoeba cyst which are usually of having 8 nuclei. So that is the point of distinction, that here there is quadrinucleate, mean 4 nucleus. Sometimes difficult to distinguish Entamoeba histolytica from the other harmless Entamoeba species. Entamoeba histolytica cysts have always 4 nuclei while the others have 8 nuclei. I have already told you. Various flotation or sedimentation procedures used to recover cyst from the feces, or one can do iodine stain to visualize the isolated cyst for the microscopic examination. Since cysts are not shed constantly, a minimum of 3 stool examinations are necessary to find the cyst. Motile form trophozoites are sometimes seen in fresh feces. So here one can see the stool examination and one can get the trophozoite here and the cyst with the 4 nuclei that can be seen in the stool when it is done the stool examination under microscope. Number 3 in the diagnosis is blood examination. There is mild leukocytosis, that is TLC is about 15,000 to 30,000, and there is raised ESR that is above 50 millimeter per hour, and there is also the raised liver enzymes, that is the raised LFTs also. Now, number 4 in the diagnosis is serological test. That is the most accurate test to detect specific antibodies or the antigens in the patient serum, but the test remains positive even after the treatment, and it is negative in intestinal cases and in case of the carriers. But the tests are positive in extraintestinal and chronic cases. Here, a skin test is done by intradermal injection of 0.1 ml of antigen, and serum antibodies are detected which are formed against this antigen. By slide agglutination, co-agglutination test, complement fixation test, CFT, and precipitin test, or by ELISA, we are able to detect the antibodies which are formed against this antigen. Now, continuing the serological test, antibodies are much higher in case of the liver abscess, and serology is positive 2 weeks after the infection. This test is used if 3 consecutive stool examinations are negative. So then we can go for the serological test. Number 5 in the diagnosis is radiological examination, X-ray, CT scan, mostly to see the extra-intestinal lesion like the abscess are detected by radiological exam. Then number 6 is aspiration. It is done under ultrasound supervision or the guidance to aspirate pus from the abscess anywhere in the body. The number 7 is biopsy. It is done in cases of the abscess or to see the intestinal lesion directly by the colonoscopy or the sigmoidoscopy, and we do take the biopsy while going through this procedure, and we can see this biopsy under the microscope to confirm the diagnosis. Now, here one can see the MRI or CT scan, the liver abscess, and here a smaller cylinder core of the tissue is removed with the biopsy needle to see the tissue of the liver and undergoing the changes because of this amebiasis. Now, continuing the biopsy, colonoscopy can detect small classical flask-shaped ulcer of 3 to 5 millimeter size, and trophozoites are seen at the edge of the ulcer. Mucous membrane between these areas look either healthy or inflamed. One can use immunohistochemical staining with specific anti-Amebiasis histolytica antibodies. So, the number 8 of the diagnosis are other tests, that is, the PCR is done, which is a gold standard for the diagnosis. Then hepatic photoscan can be used to see the hepatic involvement. Sputum examination for Entamoeba histolytica, trophozoite in the pulmonary abscess or the pulmonary amebiasis. So here one can pass the colonoscope, as one can see, and colonoscopy is done and one can see the ulcer there, flask, and one can also see the trophozoite there, and one can also take the biopsy. So that is, one can see the typical classical flask-shaped ulcer. Trophocytes are at the boundary of the necrotic and the healthy tissue, and it is causing the dysentery, that is blood and mucus. And here also one can see the ulcer with the raised borders, and there is very little inflammation in between these ulcers. Now, the differential diagnosis of Amebiasis, that is number 1, bacterial dysentery, acute appendicitis, giardiasis, and point to differentiate are, that is mucus and blood in the stool is seen in Amebiasis. Cyst and trophozoite in stool are seen in Amebiasis, and there is no granulocytosis and no high fever as it is seen in case of bacterial dysentery. And one can see the strength of an elephant. If the elephant is really having the strength, he can lift the small sized 3 elephants on his body parts and just make them to dance whatever the way this elephant wants. Now, coming to the treatment, Entamoeba histolytica infection occur in both the intestine tissues in people with the symptoms and in the extra-intestinal tissue like the liver, brain, and other tissue to form the abscess. There are 2 types of the treatment depending on location of infection, and these are medical and surgical. First, the medical. Those with the symptoms require treatment with 2 types of the medication plus symptomatic treatment for the pain, tenesmus, or the fever, that is the sportive treatment. And amebicidal tissue active agent and a luminal cysticidal agent means the cysts which are present in the lumen of the colon or the intestine, these are going to be killed by luminal cysticidal agent, and the amoeba which has got entry into the tissue, these are being killed by the tissue active agent. Now, the medical individuals that are asymptomatic only need a luminal cysticidal agent, that these people are going to pass the cyst which can be infected for the other healthy people. Luminal or intestinal infection is treated with diloxanide furoate, idoquinone, or paramomycin. These are the luminal or to treat the intestinal infection. Now, extra-intestinal amebiasis is treated with metronidazole, tinidazole, nitazoxanide, dihydroamidine, or the chloroquine. And effective treatment may require a combination of the medication which are given already. So one can use diloxanide furoate and diiodohydroxyquinone tablets or paramomycin. These are basically 3 medicines which are having the effect inside the lumen of the intestine. So these are luminal cysticidal drugs. Now the other is tissue which act on the tissue and the abscess, that is metronidazole. Then there is tindidazole, and there is nitazoxanide, and dihydroamidine, and chloroquine phosphate tablets. These are all meant for treating the extraintestinal tissue or the abscess which these trophocytes do form. Now, surgical amoebic abscess heal at the same rate with or without aspiration. Abscess with the secondary bacterial infection must be drained surgically. Abscess involved in the other organs respond well to the drugs and require drainage, and it is a rule that wherever abscess that is not going to be treated well with the medicine, it always needs NCN and drainage. Aspiration of the pus done in the intercostal space above the area of the tenderness, and indication of the aspiration are to rule out pyogenic abscess which are multiple, imminent to rupture, and these are not responding well to the medical treatment. Surgery is required if the abscess rupture into the peritoneal or pericardial cavity, and here one can see the surgical drainage of the abscess by putting a drain and to make out thick chocolate colored or pus with the trophocyte. And the last is how to prevent the disease. So the prevention is wash the hands with soap and hot running water for at least for 10 seconds after using the toilet or changing a baby's diaper and before handling the food. Clean the bathrooms and the toilets often, toilet seats and the taps also. Avoid the raw vegetable in the endemic areas, as these raw vegetables have been fertilized using the human feces. Boil the water or treat with the iodine tablet. Avoid eating street foods in public places and sharing the sausage in one container. Amebiasis histolytica cysts are resistant to the chlorination, so use the sedimentation and the filtration or the of the water which is going to be used for drinking purpose. So that is the end of the amebiasis. I have tried to give as much as possible and as convenient, as easy as possible. And if you like so, please subscribe my channel and share it with the others also. If you have any question, please do not hesitate to talk to me. And thank you very much for patient watching and listening.